Hello everyone. IINN Live is a show dedicated to the groundbreaking company Inspira Technologies, that its mission is to create a paradigm shift in the respiratory care arena. Inspira's scalable technology, the ART system, is a solution based on extracorporeal respiratory support approach that has been proven to be the most effective treatment for patients with acute respiratory failure. Today we're hosting Joe Hayon, the President, Chief Financial Officer, and one of Inspira Technologies' co-founders. Hi, Joe.
Hi there.
Is there strong scientific evidence that extracorporeal treatment works on acute respiratory care patients?
Yes, of course it is. ECMO is a superior, proven technology. We've seen this in COVID. There were many cases where patients were placed on invasive mechanical ventilation and it just didn't help.
Right.
Young patients, and the doctors looked for new ways of saving them.
Right.
So they actually started putting them on ECMO, and there were some success stories. So we have, as a result of COVID and the doctors applying ECMO to treat COVID, there are many scientific articles and publications around the subject. But the thing with ECMO is that it just is very risky and very expensive. It's not used that much because of the high risks and the need for such a highly experienced medical team. Now, the concept today has always been around replacing organ function. And we see this in invasive mechanical ventilation, and we see this again in ECMO.
Right.
And this is where the ART offers a new approach. We're supporting the sick lung instead of replacing it. And we can support it with intent to support it while the patient is awake and it's still breathing simultaneously. And this makes the treatment process a lot more effective in the sense that the patient can communicate with the doctors.
It's not so scary.
Exactly. So we're bridging that gap while the doctors take care and try to resolve the underlying medical problem.
Wow, that's great. So can you tell us about Inspira Technologies' scientific work?
Yes, we've performed several in vivo preclinical studies, and they've been performed on large swine models.
Right.
Now, swine models, they have the same anatomical characteristics and
as
cardio
humans.
output just as humans.
Yeah.
Exactly.
Yeah.
And most of our studies, they've been around using a blood flow rate of about 1 liter per minute, again, associated with our technology.
Right.
Now, during the studies, we are placing the swine models into an induced state of hypoxemia. Hypoxemia.
Hypoxemia.
Yes. So hypoxemia is a state whereby the patient in humans would have a very low oxygen level.
Yeah.
Would normally be as a result of a medical condition that requires immediate attention, for example, ARDS.
Right.
Now, during our studies, once we place them into the swines into a state of hypoxemia, you can see their oxygen levels plummeting to about 80 to 85%.
Okay.
So this would be a condition that a patient would definitely require, most likely, invasive mechanical ventilation or even ECMO.
Of course.
Now, during the study, we are activating our system. We are circulating the blood. We are treating the blood, oxygenating the blood. And what you can see is, within minutes, a boost in the oxygen saturation levels. And this is visible in the pulmonary artery, which on average increased by 26%.
Wait, how many minutes are we talking about?
Very few. Just a couple.
Like 5 minutes?
Just a couple, even less.
Wow.
And, we've also seen the saturation levels in the carotid artery also be increased by about 8 to 10%. So, if we just look at it from the side, if a patient basically deteriorated about 85%, the system should have then the capability or is designed to increase the oxygen saturation back up to about 95%, which is the kind of level that you want to target. Now, we're also able, and we've proven that we can reduce the CO2, the carbon dioxide, by about 5.6 milligram mercury. So we're not only increasing the oxygen saturation level, we're also removing CO2.
Okay, but what happens after with the CO2?
So by removing CO2, you're obviously improving the overall medical condition of the patient.
Okay.
Because, most of these medical conditions are either a low oxygen level or a problem with removing CO2.
Okay.
So by doing so, we can actually elevate the oxygen saturation level, reach those targets. And in a sense, you can see that our in vivo preclinical studies demonstrate ART's unique capabilities to oxygenate and remove excessive carbon dioxide in a very significant manner.
Thank you for being here.
Thank you very
and
much.
for giving us your time. And to you viewers, Stay safe.